Andrew Cheung is currently working as a pharmacist in hospital, but also has experience working in the local community. So, Andrew, tell us what an average day looks like for a hospital pharmacist.
So hospital pharmacists can vary depending on where they are working in the hospital. So as a clinical pharmacist myself, I work on the ward directly with patients face to face, and I work alongside and support doctors and nurses. So typically in the mornings, we would start off with a morning meeting where we would discuss patient treatments and also any new patients or patients who need critical care quite urgently. As the medicines expert, a lot of the different professions of healthcare look to pharmacists to guide them about medication safety and the most appropriate medicines for patients. So apart from clinical pharmacists in hospital, the pharmacist's role can vary to dispensary. A lot of junior pharmacists, when they first start off their career in hospital, they would be situated there where they have the opportunity to learn and hone their skills and clinical skills, working alongside more experienced members of the team. And eventually, as you progress to a clinical pharmacist role, you can even progress to a prescriber, where you'd be in charge of running clinics and even go up to a managerial level where you would be responsible for running an entire department. So the roles are varied and opportunities are vast.
So you mentioned working directly with doctors and lots of other members of the wider hospital team. What is it like being part of that group?
So working in a multidisciplinary group of professionals is fantastic. I actually love it. Apart from doctors and nurses, we work alongside physios, occupational therapists, speech and language therapists. Don't want to leave anybody out. There's a wide variety. And as I've mentioned, being the expert in medicines, my role on the team is to ensure safety of medicines for patients. So it's absolutely brilliant. And just because I'm the only pharmacist on the ward, it doesn't mean I'm working alone. If there's ever a time where I don't know the answer, which is rare, I would look to my other colleagues in the hospital who would have a vast knowledge and different experiences and specialities as well to fall back on. So you're never truly working alone in hospital.
It sounds like you really love your job.
Yeah, it's great.
So you're a member of Pharmacy Forum NI's Equality, Diversity and Inclusion Committee. What encouraged you to take up that role, and is this sector welcoming and inclusive in Northern Ireland?
Yeah, Rebecca, so I decided to become the chair of the committee purely because, well, I was born in Northern Ireland and I'm from the Chinese ethnic minority background myself. So I felt initially that we were quite underrepresented, but I feel as the chair I can help improve these things. But it's not just about race and discrimination. We are focused on tackling a wide range of topics, some of which can include gender equality, transgender topics, LGBTQ, amongst a whole load of others that we're planning to tackle in the next coming year. So there is quite a lot that we can get on with, and I think it's very important that we do so, purely to help welcome the next generation of pharmacy colleagues into the sector.
Amazing. Well, I'm sure everybody watching will be totally inspired. Thank you so much for joining us today, and good luck with everything you're doing in the hospital. Thank you.
Thank you.